Hello, this is Dr. Do again. This video is on alphabetic list of problems on letter H. I think today I'm going to talk about the hepatic diseases, which is referring to the conditions occur to the organ of liver. So, before I talk about the details of individual hepatic diseases, I'll just mention is any emergency situation associated with this hepatic disease warrant emergency visit. I think there are. As I previously mentioned, if you follow my stream of video on letter C, I talk about the cirrhosis, which might be complicated by the varicosis along the esophagus. So that if that's the case, increase the risk of bleeding, vomiting blood. So that's one of the situation really warrant emergency visit. Or if the hepatic disease is very severe, it's caused by the viral infection, caused the complicated or long-term viral infection complicated the cirrhosis. That's the same idea. And the other situation is the hepatic encephalopathy, which is also because of the toxin getting to the brain, impaired nerve function, cause the coma, loss of consciousness, and delirium. So these are the important emergency situation need to visit emergency room. Or long-term drinking cause the hepatic disease and also cause the cirrhosis, either cause the varicosis of the esophagus or the encephalopathy. Or so these are all the emergency situations associated with hepatic disease, as I mentioned before in the cirrhosis section. So anyway, is there any hepatic disease that you can manage at home? Probably not. Even though, for example, the hepatitis A is pretty much a supportive symptomatic management, but still need to be diagnosed, and need to be treated, or need to be monitored under the medical professionals and otherwise from your physician. So basically, any kind of liver disease cannot be managed at home, even though, for example, the liver disease caused by the fatty liver disease, probably early stage, there's nothing, no medication or no need for medication, but just the lifestyle modification. Even though it is the case, still need to be follow up with the physician regularly, because it can progress to the severe situation and also need to be managed by the medication. So anyway, so basically these are the two ends, either emergency or home management. Talk about the hepatic disease, start from the hepatitis and the cirrhosis and also the fatty liver. So hepatitis, it's so common, commonly mentioned. Hepatitis A, hepatitis B, hepatitis C. What are those? Why it's categorized in this ABC? So basically, hepatitis B and hepatitis C share a lot of common aspects in terms of transmission pathway of route or pathway of transmission, in terms of management, in terms of the antigen antibody tests. They're quite similar. Hepatitis A, on the other hand, really is different in terms of this either the transmission pathway different from the B and C. So let's start from hepatitis A. Hepatitis A is really occurred in endemic area, especially if you travel to those underdeveloped or developing country. So everybody, if you go there, you need to talk with the travel medicine professionals about the vaccine, about the immunization. So if you travel to those areas which had the endemic of hepatitis A, then you need to be vaccinated. Basically, hepatitis A is usually the acute, majority of cases self-limited, and transmitted by the food intake, the oral pathway, and symptoms like very beginning probably subtle nausea, vomiting, and jaundice and fullness or comfortable on the right upper abdominal quadrant area, and usually there are a couple weeks of the incubation period after the infection, and then start showing this kind of symptoms. So the immunization is necessary and is effective to prevent it from occurring. So this is hepatitis A. There is some cases of hepatitis A. Very small portion of cases can become severe or chronic, but usually it's not in the carrier state. So the virus infected and then cleared out. So that's a kind of acute process. In terms of hepatitis B and hepatitis C, by the way, hepatitis A, B, C, they all caused by the viral infection. So hepatitis B and hepatitis C, they share the route of transmission similar through the body fluid contact, either, for example, the blood transfusion or the injection or the needle. And hepatitis B has immunization vaccine already available, usually 3 or 4 doses since newborn, and it's really effective. And after the immunization or after the infection can be detected by the antigen or antibody, different kind of antibody, different kind of antigen, indicating whether it's immunized or whether carrier, or whether acute or whether chronic infection. So these are really up to the physician to determine or to diagnose you, to tell whether you were immunized or whether you were carrier or whether you are on the acute or chronic stage of this hepatitis B. And hepatitis C, similar to hepatitis B in terms of transmission, body fluid contact, share needles or transfusion. Unfortunately, hepatitis C does not have vaccination, cannot be immunized. There's no immunization available right now. So nowadays the cirrhosis or the chronic hepatic disease or the serious sequelae of the virus infection of the liver, probably hepatitis C is more recognized and it's identified more incidents. So eventually both of hepatitis B and hepatitis C increase the risk of hepatic cirrhosis, increase the risk of hepatic cancer. So has to be managed by your physician, either as a chronic or carrier or acute infection. There's some antiviral medication available for both B and C hepatitis. And hepatitis C, by the way, is also can be detected by the serology analysis. You test the blood, test antigen, antibody. And so this is about the hepatitis, hepatic disease. Just talk about hepatitis A, B, C. And next time I'm going to talk about the most serious or more common conditions like a fatty liver disease or the hepatic cancer. So I'm going to stop here. Thank you for watching. I will see you next time.